Hi everybody and welcome back. My name is Mark. I'm the Senior Osteopath here at ML Therapies, and in this video we're going to walk through a spring test for iliosacral dysfunction and a separate spring test for sacral dysfunction. Now the spring test for sacrum is primarily going to indicate whether we have a flexion or extension lesion, which would then determine if we have a left on left, right on right, left on right, or right on left dysfunction with the sacrum. Our iliosacral spring test is merely going to tell us if we have a restriction involved with that innominate on the sacrum. So next video is just going to walk you through both of those two spring tests. Alright guys, so in this video we're just going to show you the iliosacral spring test for iliosacral dysfunction. So if we place our hands across the iliac crest, follow a 45-degree down to find the PSIS. Once we're confident we have the PSIS, what we can do is to check the patient's left-hand side, place the pisiform of the left side on the left side, stabilizing the sacrum in the middle, rotate down and compress the SI anteriorly towards the table. To check the contralateral side to the operator, the right hand can place across the sacrum. The thenar eminence of the hand can go towards the SI. Rotate down, laterally shift a little bit if needs be, and compress in an AP fashion down towards the table. What we're looking for is an asymmetry in spring. If we have a restriction on the spring on one side, that can indicate an iliosacral dysfunction on the side of reduced spring. Our next test is our sacral spring test. So we can use the same landmarks for our PSIS, move medially, superiorly into the sulcus of the sacrum. We can then place our thenar eminence broadly across the sacrum, or we can check left versus right as well. But if we place our hand across and spring anteriorly, if we have a nice comfortable spring with no pain, if we have a positive sacroiliac dysfunction, this can indicate a left on left or a right on right nutated dysfunction. If we have pain and restriction on anterior AP push, it indicates an extended sacrum, which would be a counternutated or extension, and a left on right or a right on left sacral dysfunction. Now, they all mean different things and they will be discussed in a separate video. Hi everybody, thanks for watching. So we've just demonstrated an iliosacral spring test for iliosacral dysfunction, and we've also just demonstrated a sacral spring test for a nutated versus counternutated left on left, right on right, or left on right, right on left sacral dysfunction. It sounds very confusing guys, but once you really get the hang of it, it's really not that hard. So if you like what you see guys, hit like and subscribe on the bottom, and if you have any other videos you'd like us to do, please send us a private message as you've done before, and we should be able to try and get that video for you as soon as we can. Thanks a million guys for watching.